Bismillahirrahmanirrahim. Today we are going to discuss the cavernous sinus. Each cavernous sinus is a large venous space situated in the middle cranial fossa on either side of the body of the sphenoid bone. Its interior is divided into a number of spaces into spaces or caverns by trabeculae. So it's richly a network of venous sinuses. It is about 2 centimeter long and 1 centimeter wide, and as you know that sinuses are actually the spaces between the two layers of the dura mater. So it's a kind of modification of the dura. How is cavernous sinus formed? The floor and medial wall of the sinus is formed by the endosteal dura mater. So this is the point actually. The floor and the medial wall of the sinus is formed by the endosteal dura mater. The lateral wall and the roof are formed by the meningeal dura mater. So here you can see this is the medial wall. This is the medial wall of the cavernous sinus, and this is the lateral wall of the cavernous sinus. Lateral wall. So all these are formed by the endosteal dura mater. The lateral wall, as I said, is formed by the meningeal dura mater because it is more toward the brain parenchyma. This is the temporal uncus and temporal lobe. So what is the extension of cavernous sinus? Okay, so we will repeat the boundaries. So the lateral boundary is formed by the meningeal, the lateral wall and roof is formed by the meningeal dura mater, and the medial wall and the floor. The medial wall and the floor. The medial wall and the floor is formed by the endosteal dura mater, and the roof and the lateral wall. The roof of the cavernous sinus is called diaphragm sella. Diaphragm sella. What is the extension of cavernous sinus? Anteriorly, the sinus extends up to the medial end of the superior orbital fissure. Medial end of the superior orbital fissure. Posteriorly, up to the apex of the petrous spot of the temporal bone. So this is your cranial cavity. This is your cranial cavity, and we have the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. So you should know that anterior cranial fossa, here we have the superior orbital fissure, okay, and here we have the foramen magnum, okay, and posteriorly here in the middle cranial fossa we have this kind of elevation which is called the petrous spot of the temporal bone. So posteriorly it goes to the petrous spot of the temporal bone, anteriorly it goes to the superior orbital fissure. So this is, remember, this is a YY exam. This is a YY exam, so you have to practice speaking. This is not MCQ like one word thing or exact word thing. You can make your own imagination and speak out. So structures related to sinus. So these are the relation of the sinus. So here we can see that it's related to the optic tract, optic chiasm, olfactory tract, internal carotid artery, and anterior perforative substance. So here we can see that this is the optic chiasm, and anterior we have the optic tract, optic nerve, and posterior we have the optic tract. So superior, this is related to the optic chiasm, optic tract, optic nerve, and everything optic. So also this internal carotid artery you can see here. And here we have the posterior perforating body, and there is one other anterior perforated body. So anterior perforated body, sorry. And also we have like this is one portion, and when you come forward you will get the olfactory tract and olfactory bulb. So inferiorly we have the foramen lacerum, and the junction of the body and the greater wing of sphenoid. I will show you it another diagram. Hypophysis cerebri medially and sphenoid and sinuses. So here medially you can see this is the pituitary, hypophysis, and the sphenoid sinuses. So medially this, superior we discuss this area, medially this area, and Inferiorly, we have the foramen lacerum and the junction of the body and lesser venous phenide. Sorry, greater venous phenide and the body. Greater venous phenide. So laterally, we have the temporal lobe of the temporal lobe with uncus. Temporal lobe with uncus. This. Okay. So these are the relations, and you can also say that below laterally we have the mandibular nerve. Okay, below and laterally we have the mandibular nerve. Anteriorly, superior orbital fissure, as we discussed in the extension, superiorly or anteriorly it extends into the superior orbital fissure and the apex of the orbit, and posteriorly apex of the petrous part of the temporal bone and crus cerebri of the midbrain. Crus cerebri, the two cruri of the midbrain. Okay, so tributaries, from the orbit it receives the superior ophthalmic vein and inferior ophthalmic vein, and also communicate facial. So that's why the facial facial vein can cause the transmission infection and thrombosis of the cavernous and central vein of retina. So superior and inferior ophthalmic veins and central vein of retina. From the brain it receives superficial middle cerebral vein and the inferior cerebral vein, and from the meninges it receives the sphenoparietal sinus, the frontal trunk of the middle meningeal vein. Contents. So we have the lateral wall and the contents of the sinus itself. So in the lateral wall we have the mnemonic O-Tom Kate. It's a very old mnemonic. We used to remember this, or we used it in the final year medical school. So from top to bottom we have the oculomotor O-Tom, O oculomotor, T trochlear, ophthalmic nerve, and the maxillary nerve. From contents of the sinus itself are internal carotid artery in the sympathetic plexus which surround the internal carotid artery. It goes into the cranium, and the abducens nerve. So yes, so what are the sensory nerves in relation to a cavernous sinus? So optic nerve, superior relation, ophthalmic and maxillary divisions of the trigeminal nerve, and trigeminal nerve itself. Lower lateral relation drains blood into superior and inferior petrosal sinuses and internal jugular vein and intercavernous sinuses. So these are the yes, we can here clarify some of the concepts. So this is the this is the chiasma, the optic nerve, and the optic tract. So this comes in superior relation. Lower and laterally we have here the if you see, this is the foramen. Well, so we have this the mandibular nerve. Okay, and with this we have the this is the diaphragm cilia above it, and here it communicates with the superior and inferior petrosal sinus to the sigmoid sinus, and also it continues as an internal jugular vein. So that's why we say that it's these are the tributaries. Due to infection from the dentist area, what is the clinical significance of cavernous sinus? So it can lead to cavernous thrombosis. Due to infection from the dentist area of the face, drain through ophthalmic and facial veins may spread to cavernous sinus and draining because there is no walls. Sinus of thrombosis. If you got a cavernous thrombosis, what will occur? So you will have a painful eye, and so this person is the crying. So you have a painful swelling of the eye, third, fourth, fifth, and sixth cranial pulses, ophthalmoplegia, and the gradual loss of vision. Cavernous sinus syndrome is most commonly caused by cavernous sinus tumors. So tumors are the most common cause, not the infections, but infection can cause the cavernous sinus. Diagnosis is based on signs of pain. If a person has a painful eye, ophthalmoplegia, ptosis, trigeminal nerve lesion, ophthalmic branch, and Horner syndrome, so always suspect this cavernous sinus thrombosis. So this is all about the cavernous sinus.